Infertility affects more than 48 million couples in the world. Of these, 10 million live in sub Saharan Africa. In South Africa, infertility occurs in 15% to 20% of the population. That's one in every six couples. The prevalence of infertility is much higher in developing countries than in the developed world. With June being World Infertility Awareness Month, we thought it perfect to shed some light on this topic. And Saskia Williams, the founder of Infertility Awareness Association, is joining me. And I'm also joined by clinical psychologist and life coach Mandy Rodriguez. Good morning to you, ladies, and thank you for joining me.
Thank you,
Morning,
Miriam.
Thank you for having us on.
Right, infertility. This is a topic that often goes unspoken of. It's something that people tend to keep on hush, and it's always something that happens to women only. But we know that's not true. I mean, men go through infertility as well. But let me start with you, Saskia, by defining to us what is infertility and what do we know about it.
Okay, so infertility is the inability to carry a pregnancy after 12 months of trying if you're under 35, or over 35 after 6 months of trying to conceive. So you don't fall pregnant within that time. That is classed as infertility. And as you said, Miriam, it's actually 40% a female infertility issue or fertility issue, 40% a male fertility issue, and then 20% is either both of them, both the couples, or it's another problem. But 40%, so it's even, right? It's not just a female problem, it's also a male problem, which is why we really encourage the men that are involved in the partnerships with their wives to go, or their partners to go to all the appointments that the ladies go to, because they also need to be tested as much as the females do, and they also need to know what the issue is with regards to them as a couple, because we look at it, and I know Mandy will say as well that we look at it as a couple problem. Whether it's me that is infertile or my husband, it's a couple problem. We both cannot conceive a child with this infertility diagnosis. So that's how we look at it.
Mm-hmm. All right, so Mandy, would you like to add on to that?
I would. If we look at prior to the 20th century, it was always the women's fault. It was always women had to go to spa towns in the 18th century and ease their nerves, and it was seen as a psychosomatic condition. And it was these tremendous advances in medical science. So the birth of IVF, which made us realize that it's actually the union of the egg and sperm. So just like Saskia says, it's a couple problem physically, but more so I'm seeing emotionally, because it impacts on the couple's life, their values, their financial aspects, every single aspect, the extended family. So it's not only biologically a couple problem, but more so psychologically and socially.
Mm-hmm. And it makes you wonder, where does the stigma come from? Like, why have people always thought it to be a woman-only problem? Mandy?
I think that it's just because historically it's always been, from biblical times, it's always been the responsibility of the woman. If we have a look at who carries the baby, I think a lot of the stigmatization and the stereotypes was about the woman. And men would traditionally go out and have a baby with somebody else. I think as we've approached more modern times and we've realized that actually sperm has a greater impact, especially with lifestyle factors and the modern world that we're entering now, we're starting to realize that we can be a bit more open about it. You also think about men, if they've got a sperm issue, they're far less likely to speak about it than the female is. And they tend to be, I don't want to say ostracized, but stigmatized a bit more by their male counterparts. So they're more reluctant in the patients I see to actually express that they've got a fertility problem.
All right. So, well, that does make sense. And then what causes infertility, Saskia?
It's difficult to put that into something, because I'm a lay person. I'm not a doctor or a specialist, but there are numerous factors that cause infertility. So it can start from a really young age for the lady with problems with her menstruation, and that should raise alarm bells. So we like to educate from a young age, from puberty, because if you've got issues with menstruation, it might end up being issues further along the line when you want to try to conceive. So, there's endometriosis, there's polycystic ovarian syndrome, there's all those kind of known issues or known chronic illnesses. But at school level, so to speak, we taught how not to fall pregnant. In biology, we're taught how babies are made, and then we are told how not to fall pregnant. So we're not actually educated on the issues that may arise further down the line when you want to be planning your family. And, we might leave it longer because we think we have a lot of time, and we actually end up not having a lot of time because we've had issues with our periods for the past, 15 years, 20 years, and we just haven't paid attention to it because, don't really talk about that sort of thing. And it ends up being a problem, and you should have maybe started trying in your mid-20s instead of waiting to your 30s. So it's all about educating and learning about what your potential issues could be. But it's also when you are trying, and we know our bodies better than anybody. And so when you are trying for a family and you don't feel like, it's working, and they say to allow for a year when you're under 35, but don't have to wait for a year. You can go for a full workup with a specialist. You don't have to wait for a referral from your GP or your gynecologist. You go for a workup so if there will be any potential issues that you'll be facing. You don't need to wait 12 months. If you think that something may be wrong, if your mom maybe had an issue, speak to your mom, speak to your elders, speak to your grandparents, they don't generally talk about it, but they'll tell you, actually, no, it did take us a long time to fall pregnant. We did lose 2 or 3 pregnancies in between. They don't offer that information, but if you ask them, they will tell you. And if there is that kind of history in your family, the suggestion is to go and get checked out by a specialist sooner rather than later.
Mm-hmm. All right. And now you mentioned that you look at one's period and look at the problems that they may be facing. Now, can a person who is or infertile or have infertility issues get their regular period?
Yes, they can. So even people who have tubal disease, which is a huge factor in in Africa, and so that's when our tubes are blocked or there was a previous infection. The sperm and egg are just, there's no way for the egg to get into the uterus. So you're not ovulating at all because your tube is damaged. So your cycles are absolutely regular. And in fact, you can have thyroid problems. You can have a whole lot of lifestyle induced factors, which create still regular cycles and everything appears like it's normal. But in fact, if we do these subtle blood tests, which are very specific to fertility, we can then pick up that there's maybe a thyroid issue or an insulin issue. Another factor is we're seeing a lot of teenagers. I'm seeing a lot of girls who maybe had eating disorders in adolescence, not thinking that actually this is going to create a problem when they're trying to have a family. People who are smoking excessively, people who are eating the wrong diet. It's little lifestyle tips that are going to help individuals kind of across the spectrum of becoming a parent and then being a grandparent eventually, that we can tweak and change, that needn't require a huge invasive procedure. So like Saskia says, go and check your baseline levels, check what your egg quality looks like. Are you ovulating? Because the majority of patients I see, they appear absolutely healthy and they have no idea that there was something wrong.
Mm-hmm. All right, so we're going to take a quick break, but when we return, I'd like to talk about the mental well-being and how does that impact on one's ability or inability to have children. Ladies, please stay with me. We will be right back.
The comfort of my childhood than the smell of black seed oil being applied by my nanny. Now I'm using Tib black seed in my own home to soothe sniffles and coughs, to help with digestion and immunity, and of course, as part of my beauty routine. After all these years, I've come to appreciate the wisdom in finding comfort and shifa in trusted treatments like Tib black seed. You can find Tib black seed at all leading pharmacies or find out more at blackseed.co.za.
Approximately 785 million people in this world do not have access to safe, clean water. In developing countries, around 80% of all illnesses are due to contaminated water and poor sanitation. Don't let dirty water end a life. Build a water well in Bangladesh, Malawi, Nepal, Zimbabwe, or here at home in South Africa. Donate to Penny Appeal's Thirst Relief Project to bring safe, clean water to communities around the world. www.pennyappeal.org.za or call 031 1100 573. Penny Appeal. Small change, big difference.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness, and every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. Come to us. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and freezer card calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
Sustain, sacrifice, share.
Africa.
This Eid al-Adha, donate your Udhiyah Qurbani to Africa Muslims Agency. We ensure that your Qurbani not only feeds the poor, but creates sustainable incomes for local farmers, brings the practice of sacrifice to the villages, and shares the spirit of Eid. Sponsor in South Africa for 2,650 rands. Africa, 1,650 rands. Palestine, 7,250 rands per share. Or in Lebanon, Afghanistan, and other countries across the globe. Visit africamuslimsagency.co.za for pricing and to donate. Call Africa Muslims Agency now on 011 834 8685. Africa Muslims Agency, commemorating 35 years of empowering, educating, inspiring.
Breaking stereotypes, moving boundaries, joining hands. Salam Media. Humanity sets the agenda.
Welcome back. It is 11:18. You are listening to the Mid-Morning Talk on Salam Media, and today we are talking infertility. It is World Infertility Awareness Month, and if you have any comments or questions for our guest today, you can leave them in the comment section or send them to us on WhatsApp. The number is 061 766 0355. With me is clinical psychologist and life coach Mandy Rodriguez and Saskia Williams, the founder of Infertility Awareness Association of South Africa. Ladies, thank you for staying with me. Let's go back a little bit and talk about the symptoms and signs that one should recognize whether you are male or female. Let's start with you, Saskia. Please unmute.
Sure. Yeah, it's as I said, it's best for a specialist to answer questions about medical information like that. But like Mandy said, it's lifestyle, it's irregular periods that you'll pick up on. For the men, it's a bit more difficult. Mandy, what would it would be issues with ejaculation, that kind of thing?
You know what? I think oftentimes for the men is we tend to see the impact of the sperm only once they have a sperm count and a test their morphology. It's very hard unless we know that a woman has had previous children before and she's struggling with this current partner, unless he comes in for a test, which is why I say to the men, I know it's invasive and I know it's uncomfortable, but there are ways around it that we can have the sperm sample done at home. But the way we can clearly confirm that is do a sperm sample. Now imagine you're trying for a whole 2 years and you're going through the stress and anxiety of trying to have a baby, and then you do a sperm sample and see that there's problems with morphology or count, which we can then help you manage. But you've been trying for 2 years, an impact on your social life and your relationship. So for the men, it's pretty hard to pick up if there is an issue. Obviously, if they're not getting an erection and they've got erectile dysfunction, that is a cause, but that's not very common.
All right. Now let's talk about the mental well-being. You mentioned stress and anxiety. How is it important? How important is it rather to be in the right mental frame, or to have less stress and anxiety? Mandy?
So it's really unrealistic to say anyone going through this is not going to be stressed and anxious. It is just the natural course of trying to have a baby makes us anxious, especially that 2-week wait, and going forward and the loss of dreams, etc. But there are ways that we can manage this. And I think creating a peace of mind about what you're going through and knowing what the plan is. So getting your baseline tests, knowing what your options are, knowing that there's some sort of structure. If I run a comrades and I don't know where it's going to end, it's going to take me forever, and I'm going to get helpless and disempowered along the way. But if I know what my end goal is and what I got to get to Pietermaritzburg and then Howick, etc., then it's easier for us to manage it in those small pieces. The other thing is there is a relationship between stress and infertility. So the more chronic stress an individual has, the more they are what we call a type A personality, which a lot of us are nowadays. So we're stressed about things that are not even related to fertility. So about time issues and perfectionism issues and competitive issues. If we can reduce those kind of issues, that kind of anxiety, and manage our other stress better, it will at least decrease the stress in terms of trying to fall pregnant. And we know it has a positive impact on the immune system, which is egg quality, sperm quality, all of that going forward. There's definitely a relationship between stress and the physical well-being of a person.
All right. Now, what options are available for couples trying to conceive but can't, or are struggling due to infertility? Saskia?
Fertility specialist, that would be the first port of call. So they go and have their tested, like Mandy's talked about, at a fertility specialist. There are ones across the country. They can look for SASREG Centers of Excellence on the SASREG website, which is sasreg.co.za. And that is the first port of call. So go to see a specialist to see what your options are. What we always say, that knowledge is power when it comes to infertility. It gives you back some of the control. Like Mandy talked about, a lot of people are A-type personalities. We like being in control of things. Now I've decided I want to start my family. I'm ready. And then I can't. And it's upsetting and it's stressful. And we can't understand that losing this kind of control is very difficult for us. So knowing your options, we have a lot of information on our YouTube channels, talks from specialists, etc., all about all different variations of infertility, all the different male factor, the female factors, is to do research like that. Go online. There's a lot of information. There's also support groups out there. There's ones on Facebook. There's ones that meet in different parts of the country. Get support if you need it. The men are less likely, like Mandy talked about, to go and get support or speak to their friends about it because they're worried about being embarrassed. And, if people that, just joke about it, something that's really quite serious to them. So finding men that are going through the same thing, and there are men out there, and reaching out to us, we can put them in touch with people that are going through it. They can talk to somebody that understands where they're coming from, because men also do need support. But there are support groups out there. If they contact us on our FASA website or Facebook page, or email me directly, I can put them in touch with people that are in their area. It's very important to speak to people who understand what you're going through.
And another a problem that we find nowadays, especially when it comes to the options that are available, like IVF, is the expenses. It is a very expensive treatment, and obviously medical aids are not covering this. So why is it important to compel medical aid schemes to cover treatment for people with infertility? Saskia?
Because it's a prescribed minimum benefit disease. So it's classed as a disease by the World Health Organization. So like any disease that's covered under the Prescribed Minimum Benefits Act, infertility should be covered by the medical aids. But they get away with it because there's an exclusion for treatment of infertility. So they have to pay for the diagnosis and anything leading up to the diagnosis. But as soon as infertility is diagnosed, they no longer need to pay for anything else. They've been getting away with it for for many years. So it's a fight that we have been having since we started in 2013. And we have won, in inverted commas, one of the battles with Discovery introducing levels, but on their two top tiers, the comprehensive and the executive plans. But it's not enough. I mean, we are fighting for fair cover for all. So there are options for people at public hospitals such as Steve Biko, Tygerberg, and Groote Schuur. But I mean, if you don't live in those areas, you can't benefit from that facility, or that cheaper infertility treatment that they offer. So for people living in the other parts of the country, they need to save and pay for it privately. But they also need to know what they can claim from their medical aid. So medical aids have to pay for things under Prescribed Minimum Benefits Act. So they mustn't take it from your medical aid savings, for instance, when you're doing your diagnosis. They need to pay it out of the scheme's benefit. So if you're having issues with any of your medical aids, make contact with me and I'll put you in touch with the correct people to get those claims through. Because the problem is they're not paying for the things they should pay for either. So if they did pay for the things they should pay for, we would then have more money to put towards the actual treatment of our infertility. So it starts really at that level. They don't pay for the stuff that they're supposed to pay for, like all their staff doesn't, whatever, aren't trained properly, I don't know. But you need to contact me if your medical aid isn't paying for what they are supposed to pay for on your diagnosis. So please do. We like to approach these medical aids, and we need to start putting more pressure on the other medical aids to follow suit, and for Discovery to introduce the cover in their lower covers as well.
Mm-hmm. All right. So, now, Mandy, let's talk about the psychological aspects of infertility. How does infertility affect a person and a couple and the family? Because it's no longer just a person thing or personal thing. It becomes, across the board. Everyone becomes affected.
So I think it starts off with this lack of control and this feeling of disempowerment. I mean, many of us think that a normal transition in terms of developmental, that's my phone. In terms of developmental stages is that we get married and we have children. And when that doesn't happen, there's this huge helplessness. And we know that helplessness, and especially the journey of infertility, it's month after month after month. So it's kind of going on the worst roller coaster ride you can, and it's relentless. It just goes on. And whenever you get a reprieve and that you get your cycle and you can start again, it just carries on and on. So by the time people are presenting to a fertility clinic, 40% of the population at a fertility clinic have a diagnosed depression or anxiety. So I guess part of us trying to mitigate this psychological impact is to say, before you go through those 2 years or that year of trying and presenting to us already with a depression and an anxiety, let's try and manage that from the onset so it doesn't develop into that. We're also seeing a post-traumatic stress reaction amongst individuals. So when we're trying to fall pregnant, suddenly we see pregnant women everywhere, and we notice babies everywhere, and we notice posts on Facebook and on social media. So it's almost like being hijacked, where you're terrified of the vendor on the side of the road because everything reminds you of what you're going through. And then it develops into sometimes marital problems. Now, I'm not saying that infertility per se or fertility treatment per se results in a marriage problem, but it is the way in which men and women cope differently, and they start coping independently, that creates potentially a problem in the marriage. Men they appear to be, less engaged, and that might not be because they're not interested in having a child, but because they feel they've got to keep things together, and within a good relationship, kind of as the one is struggling, the other one gets stronger. So they perceive their wives are going through these cycles every month, and they're more likely to say, let's just look at other options, let's just give it up, you're not coping with this. The couple starts spending more and more time isolated, and then that creates the problem. And then, of course, you've got the wider family asking questions, and again, coming from a good place. When are you having children? Have you considered this? Have you considered that? And it's this support that is well-meaning, but that just creates more and more stress for individuals. So all those aspects together, the helplessness, the post-traumatic stress, the marriage problems, support, we can manage that as psychologists or support groups so that the individual is better able to cope with the treatment that they're going through and spend, less resources worrying about the other aspects.
Well, support is very crucial and very important in any aspect of life. Now, when it comes to our older generation, I think they're still catching up and they're still trying to understand the dynamics of the world at the moment and what the new age diseases. Because I mean, to them, it will be like, but we never had this problem, even though the problem was there, but they just never spoke about it. Now, how do we get them to understand? I know they mean well, but you can't always be trying to explain to them that, okay, I'm infertile and I can't have kids yet. And then, it becomes like a cycle again, and the stigma attached to the woman being the problem. And then perhaps the man has to go and marry somebody else so that he can have kids, etc. So how do we get our people to understand, especially the older generation, Saskia?
I think talking about it as much as possible will allow them to understand that the issue, it was around, like you said, was around when they were growing up and where they were trying for kids, but they just didn't talk about it. I mean, I didn't know my own mom had a miscarriage at 18. I didn't know until I went through a pregnancy loss. So they never, even though they know that you're battling, they still won't talk about it. So it's up to us as the younger generation, I say that younger people younger than me even, to have the conversation with our family members and our elders, and just to find out, like I said, to find out their history. When you start talking to them about their past, they do tend to open up some more. And so we need to it's up to us to make them understand that this disease is much more prevalent now than it was back then. It was around back then, and they didn't talk about it, like you said. And when they did have a child by adoption or other purposes, they didn't talk about it at all, and the child didn't even know that they were adopted. And now we're very open about things like that because we don't want our children to find out later on in life, and like we were hiding it. So even from that respect, when a child just turned up in somebody's life, they just didn't talk about how it arrived. They just carried on. And I think it's up to us to take our moms, or because my parents didn't understand either. And I got them to read a book by Robert Winston so they could understand that actually it's not something that's we're making up, or we're just being a bit paranoid about that we can't have kids. It's an actual thing. So you just incorporate them into the talks that you go to, for instance, or send them a link to a podcast that somebody's done, or a YouTube video that they might be interested in, or give them a book to read so they understand it from that side of things. It's not just then coming from you, their child, which they sometimes think, is a little bit of a hypochondriac. They will then be able to understand a bit more, but it's encouraging conversations to be had. That's what we talk about. It's nothing to be embarrassed about. As we said, it's a disease. It's nobody's fault. So we can talk about it, and we must talk about it.
Definitely, it's something that needs to be spoken of. That's why we are having this discussion today. Now, as Infertility Awareness Association of South Africa, what do you do, and how can people get more information?
We are a patient advocacy group, so we fight for the patient's rights when it comes to infertility, and we educate the public about infertility by holding it, not so much recently because of the COVID pandemic, but holding in-person events, information sessions, family building, explaining all the family building options that people have. We are on social media. We're on Facebook. We're on Instagram. They can contact me, which is saskia@efasa.co.za for more information. We are starting to do more in-person events now, back doing it. There is a Fertility Show Africa coming up in July, the 23rd to 24th of July, which is online and in person. So if you are in the Gauteng area, to attend it is very beneficial. There will be expert talks talking about all parts of infertility and family building. As we said, all the family building options out there, IVF, surrogacy, adoption, all of those parts. And we also have a support zone as well. They're going to be talking about how to cope, like we've been talking about today, and the different variations which Mandy will be running. So there are information sessions coming up, and we encourage people to attend and to meet people that are going through the same thing, to speak to the specialists. You don't have to go for an appointment with the specialist. At these events, you can ask them the questions that you'd like to answer. So yeah, they can contact us anytime, and I'm around and I'm available for any medical aid related questions, any information pointing them in the direction of a clinic in their area or such like.
Right. A final thoughts and advice, Mandy. What should people take away from this?
I think they need to take away that they need to have a plan in mind. As a couple, you might be doing this as a single person, but understand the value of what you're pursuing and understand that there are many alternative ways to get to that value. Being a parent doesn't mean that we need to use our own DNA. There are many alternative pathways. And once we understand that value of what we want, we can explore the options, and it gives us some peace of mind that there is a route for us.
All right. And Saskia, any advice or final thoughts on your side?
Yeah, just that infertility doesn't discriminate. So 1 in 6 couples suffer from it. So you will know somebody in your circle of friends or at your workplace that's going through it as well. So therefore, talk about it, find people that understand and help each other through this journey, because it's much easier when somebody understands what you're going through. And as I said before as well, knowledge is power. Find out information, find out your options. You will feel much happier to know what the options are and how many ways there are to build your family. And as Mandy said, DNA is not everything.
Right. Thank you so much, ladies, for your time and for joining me on this discussion. Have a wonderful day.
Thank you, Marianne,
Thank you.
so much.
Bye-bye. Saskia Williams, the founder of Infertility Awareness Association of South Africa, and Mandy Rodriguez, clinical psychologist and life coach, taking us through this discussion of infertility. It is Infertility Awareness Month, and you can find more information from Infertility Awareness Association of South Africa by visiting their social media pages. They are on Twitter as IFASA, just at IFAASA, and also you can find them on Facebook, and you can send an email to Saskia at ifasa.co.za. And like she said, infertility doesn't discriminate. So we all know someone who is infertile or struggling to have a child, and you can point them into this direction, into the direction of IFASA or any other fertility healthcare centers, etc. And who knows, you might just be making a difference in their lives. I know of someone who is going through this, and it is a very challenging time for them, for their family as well. It is a difficult time, and all they need is support. If you cannot offer anything else, at least the least you can do is offer them a support as a friend, as a partner, as a parent, as someone, and try to educate your family and friends about what you're going through. It is a difficult and challenging time, because people are going to ask questions. People want to know what is going on with you, and if you can explain to them in the best way possible, then hopefully that will be a new beginning for you and your family. You are listening to the Mid-Morning Talk on Salam Media. If you have any further comments, please leave them in the comment section, or if you have any questions, you can send them through to us on WhatsApp. The number is 0617660355. Don't forget, there will be a fertility show, Africa, coming up on the 23rd and 24th of July. That is next month. So I guess we will bring you up to speed with it and bring in more details closer to the date. But don't despair. Do stay with us. We will be right back.